Hello everyone, and thank you for tuning in. There are different approaches to radial artery access. In this video, I share my approach to access by palpation with a single puncture. Access by palpation is challenging, particularly in patients with long-standing high blood pressure, high cholesterol, diabetes, and kidney disease. These patients can have an excellent pulse, but a very small lumen which makes access even more challenging. Ultrasound-guided access has its place, but I believe access by feel or palpation is an art and skill that should be exercised when possible. Let's go. After extending and supporting the wrist with a generous towel roll and tape, I palpate for the arterial pulse, understanding that it is a shallow muscular structure. I gently roll my fingers medially and laterally, noting the intensity of the pulse, essentially feeling for the edges of the artery, and I finish on top where the pulse is strongest. I then separate my fingers to illustrate its path towards the hand and its path towards the elbow. This creates a window in my mind of where the artery is. I mark it out and alcohol wipe the area before I infiltrate the skin with lidocaine, believing that I am right above the artery that is very rarely more than 3 millimeters deep. I sterilely prep the skin and put on my sterile gloves. There are different catheter systems, of course, but I prefer to use one with a column that contains blood when the artery is punctured. And so, using the same puncture I made with lidocaine, I insert my catheter at a shallow angle, usually about 45 degrees, and I advance it slowly and steadily in plane to avoid trauma to the artery and surrounding nerves and tendons. When I get access, I note that the column fills with blood in a pulsatile fashion. I thread my wire and drop my angle to introduce the catheter into the artery as parallel to it as possible. I clean the area with the towel and secure it with a sterile dressing. I zero the line and transduce it for beat-to-beat hemodynamic monitoring and blood analyses. I hope you found this method helpful. Please like the video and share it where you find it appropriate. Be well.